Overcoming Depression with clinical psychologist Simon Turmanis, what it is and how to overcome it. So Simon, you've been a clinical psychologist for 14 years and as client liaison officer, I'm often down at reception and taking calls from clients who ring up and tell me a little bit about what they're dealing with and with their depression, and they're wanting to reduce and overcome their depression. I notice some of these clients get well through psychological therapy and are able to reduce and overcome their depression. So what is it that they do and that you and they do together in therapy that makes a difference, that helps reduce and overcome this depression?
Hi everyone. Great question, Angelica. So every client that presents here with depression is different. They're unique. They have different issues, different symptoms, and are different people, and they're dealing with different situations. So, Angelica, we need to do a thorough assessment with each person individually. So we're not actually treating the depression, we're actually treating the person and their issues. And we want to understand what situations led them to being depressed. We also want to understand what is maintaining their poor mental health or their symptoms of depression.
Okay, so what are the different types of client presentations of depression then? And what is depression? Isn't it about having persistent low mood, energy, motivation, and difficulty with concentrating, memory, decision making?
Yes, often it is, Angelica. Depression is really a label for a set of symptoms of poorer mental health. Types of symptoms, things like you were mentioning, often problems with memory, concentration, decision making. Sometimes people do have persistent low mood. There are other things though. Sometimes some clients don't have persistent low mood. They have persistent agitated mood, or they might have okay concentration, decision making, and memory, but they have a difficulty falling asleep and staying asleep. And they have very low motivation. They might have okay energy. So depression can look different for each person.
Okay, that makes sense. So can you tell us more about how then a client gets well and what they do?
Sure. So based on our assessment with that person, with the client, we identify together what are some difficult thoughts and feelings or stories going on for them.
Mm-hmm.
You might remember in our other videos, guys, that Angelica and I have covered around difficult thoughts and feelings or stories that show up, and how we can either gently make room for them, as Angelica is doing now here. Those difficult thoughts and feelings, we can push them away when we don't want to have them. Angelica, they're trying to push them away. It's hard work, isn't it, Angelica? You just want to stop, and that's very tiring. Or sometimes you can get caught up in those difficult thoughts and feelings, like they're in your face. And when they're up in your face, Angelica, it's very hard to see me or anyone who's important to you or things that matter to you. You'll focus on your work or friends or family or the beautiful day. So I'm working with those clients to notice when they're caught up in those difficult thoughts and feelings, pushing away, using skills like mindfulness, awareness. We also use this mindfulness practice record here, you can see, where the client can list difficult thoughts and difficult feelings, what situation they're showing up in, and how they try to manage those difficult thoughts and feelings. Using these mindfulness practice records, increasing their awareness to the different types of difficult thoughts and feelings or stories that show up, and then looking to make more room for them and letting them come and go by themselves, rather than being pushed around by them or caught up in them, or trying to get rid of them through other unhelpful things like, I won't think about it, I won't talk about it, I'm just going to drink alcohol when I don't feel happy, or I'll just go for a run, rather than allowing themselves to feel those feelings and have those thoughts.
Okay, so you help them make room for these difficult thoughts and feelings, much like with anxious? thoughts and
Absolutely.
feelings.
Yep.
And what else do you focus on?
So when we become depressed, and I've also had a short period where I felt depressed when I was at university. Often motivation and energy is very low, and we kind of lose contact with what matters to us, why we're doing things, what's the purpose and meaning of our life and the things we do in our life. And when we get disconnected with that purpose and meaning and the values that we have, it becomes very difficult to continue to take action towards the things that matter to us, because we've lost that connection of what does actually matter to us. So a lot of the work I'm doing with clients is around reconnecting them with their values, helping them understand what really matters to them. And then taking action again in line with those values, because when we become depressed, often we start avoiding or isolating ourselves from people and activities that in the past we used to do and we saw the meaning, value and purpose of.
Yeah. Okay, so you mentioned values. So what sort of values?
Well, what are a few things that you value, Angelica? What really matters to you in life? What about relationships or family or work or health?
Yeah. So I value, relationships, good relationships with my family, with friends. I value helping people and doing good for others. I also value sort of career and learning and growing as a person. Yeah, those are some of my values. Yeah.
Okay, so it's great you're able to identify them quite quickly.
Yeah. And what about you? What are some of your values?
Well, listening to some of yours, I hope it's okay with you. I'll say I value some of the things you value too there around friends and family and relationships and caring about other people, helping people, is a strong value of mine also. Personal growth and development for me is really important. I like to learn and understand and grow as a human being, so that matters to me. I guess, good mental health matters to me. So, I guess there's a different bunch of values there that we're talking about. Yeah.
Okay. Great. All right. So I guess that's all very helpful information, Simon. I think definitely useful to know. So then how long can it take or usually take for clients who present with depression and wanting to reduce and overcome their depression? How many sessions will they need?
Really good question, Angelica. Well, if they're going to learn the new psychological skills to notice when they're making room for difficult thoughts and feelings, pushing them away, getting caught up, if they're going to be able to apply those skills, if they're going to notice using mindfulness and awareness when they're taking action in line with their values, what matters to them, how they want to be as a person, what they want in their life, versus avoiding that or acting in a way that isn't in line with their values, not in line with how they want to be as a person, how they want to live their life, the sorts of things they want in their life and their relationships, work, health, then it really depends on how long they can do those, it takes to do that. Once they start taking more action in line, committed actions in line with their values, and here's another handout here where we help clients clarify their values. They can look at parenting, work, health, personal growth, development, leisure. We've got spirituality, community and environment, family relationships, social relationships, interrelationships. And then, of course, what we need to do is set sort of realistic goals with our clients. Well, they set their own goals, really, in line with their values, and we try and help them, I guess, come back and report on how they went with those or any difficult things that got in the way, difficult thoughts and feelings. So the sooner they're able to take more action in line with their values, manage difficult thoughts and feelings more effectively, the sooner they get well, symptoms of depression start to go. So it depends. For some clients it might be 10 sessions, for other clients it might be 15, some it may take up to a year. It depends.
Well, thanks, Simon. Thanks for letting us know a little bit more about what depression is and how to reduce and overcome it. I think it's been very helpful for me and I'm sure for others.
Great. I just want to say, anybody watching this video, thank you for watching. I hope you found the information valuable. We've got a number of videos on our website under the About Us tab, our videos. We also have them on our Facebook page, which is probably how you're watching this video, on understanding managing anxiety, questions to ask if someone's at risk of harm and suicide, and action plans to take. We have other videos on mindfulness, how to learn how to be more mindful, how to practice mindfulness, and to learn some other psychological skills like being able to step back from difficult thoughts and feelings, how to use present moment focus to make room for difficult thoughts and feelings. And if you're ever thinking about coming in for therapy, do give one of our client liaison officers such as Angelica or Tess or Natalia a call, and they'll be more than happy to hear from you and help you decide whether now's the right time for you to engage in therapy and speed up being able to improve your mental health.